healthcare workers, but also those who are immunosuppressed. And immunosuppression can come in the form of untreated diabetes. So if you have diabetes and you have no regular access to primary care, you cannot treat your diabetes. You are then going to become immunosuppressed, and then you are going to be high risk for obtaining the virus and spreading it in the community. Also, to point out, 25% of our workforce for home care are comprised of immigrants. Now, if there's one population we really want to make sure is healthy and does not have the virus, would be those who are taking care of our elderly population. And so you can't have both. You can't have safety of the elderly population when the caregivers are immigrants and don't have access to care.
Okay. There's been a lot of controversy regarding the malaria drugs. Wall Street Journal posted a column a few days ago saying we should be giving chloroquine and hydrochloroquine as a possible while a more efficacious drug is developed. What is your view on that? And the second question is there anyone who is immune to this virus, in the sense that can someone who gets the virus get it again?
As far as the treatment, there has been reports. I would say the evidence is not strong enough to where we can say with the same confidence in other settings that this drug is our best option and is it effective. However, because we're in a pandemic, we're rushing, and we're not going to be following the normal evidence-based guidelines. And so when someone is sick, no matter where you are, the philosophy is first do no harm and to offer the best treatment possible. And as of right now, there is not a lot of data. And so those drugs are one of the options, since there really isn't a formal, official, well-studied treatment.
I just want to be crystal clear, and I've shared some resources in the chat that some have seen. When we use the terms quarantine, we have to be very clear about the what that term means. And quarantine is a very different and specific term from issues like social distancing and isolation. Social distancing is a way to keep people from getting and interacting closely and actually spreading the infectious disease. That is vitally important right now across the nation. Full stop, period. The public health evidence is profound. So we need, just like as California and other states have done, to actually implement social distancing across the board. Some have been leading the way, some are lagging, and we have public health experts, including Dr. Ashish Jha and many others, who've been calling for a national social distancing effort to be able to spread and halt the transmission of disease. Social distancing is necessary. Quarantine is a very different thing. It separates and restricts the movement of people who have been exposed to a disease like COVID to see if they become sick. We've seen quarantining being used in with the cruise ships, passengers, etc. That's a very specific public health function. And isolation is yet different. Isolation prevents the spread of infectious disease by separating those who are already sick from those who are not. I want to make sure that we are clear and not actually discussing the potential economic impact of quarantining when we use that term inappropriately. So I shared resources to help clarify the use of those terms. I recommend and advise all of us be familiar with the social distancing, quarantine, isolation. They're very distinct and separate but interrelated functions, but they do not mean the same thing. The second quick thing is, my colleague Daniel comment, the evidence is strong right now that the potential harm of widespread use of hydroxychloroquine right now is clear. The potential benefit is unclear. And so we already have a report of a death of some family who actually overdosed on that medication. The last thing to do right now is to recommend to communities of color or any community that they start buying and taking this medication when the evidence is unclear. Public health scientists, clinicians, and others are the ones who are doing the clinical trials. There are more than 50 drugs right now being evaluated. This is just one that was out there. Again, there is unfortunate misinformation that is spreading because some individuals, including those in federal leadership,
type in your question, and then when we send out the materials to all the participants, we will send the questions to the speakers, and that way we can try and get your question answered after the fact. So the first question by Han Lee, and then one more question.
Hi, this is Han from the World Journal. Thank you. I have a question about those people might have coronavirus but without symptom. So if these people are recommended not to going outside, shelter in place, not to spread the virus, but for themselves, if they continuously without symptom, does that mean they will finally recover? So a lot of younger generation or people without symptom, they might just stay at home or just don't know what to do.
Yeah, so yes, totally. A lot of people will have no symptoms and they will recover without any problems. The question is how long. Typically, we think the course is something where around 2 weeks. Unfortunately, they are infectious during all that time, so that's the reason why they need to isolate. I did want to answer the question about the immunity. There is some evidence that some people are developing immunity with antibodies. The question is how long that immunity lasts and whether or not reinfection can occur. We don't know the answer to those questions. As a matter of fact, there's been some report that some people in China have actually had recurrence of the virus without the same symptoms. So a lot of things are still unknown about that.
This is Henrietta. Can you hear me?
Yes.
Thank you. We are told to self-isolate, to shelter in place. However, health workers cannot shelter in place. And I'd like to know, what are they doing to avoid the disease, since they have to work with all kinds of patients, not only with the coronavirus, with all kinds of viruses and colds. So how can doctors like yourselves, how can you stay healthy?
This is where I think policy is so important. We need equipment to stay healthy. There's no question that all of my colleagues are really working extra hours. They're putting themselves and their family at risk. It's not just them getting sick, but they bring it home to their family. There are lots of stories about us coming home to family where we have to decontaminate ourselves before we can even go in. Some people are not even living with their family because they don't want to put them at that risk. We need proper equipment. We need personal protection equipment. We need masks. We need gloves. We need everything. And right now, we don't have enough. And I think what's happening is a lot of people are reusing equipment, using inferior equipment, and they are getting infected and they are dying. There have been reported cases of healthcare workers dying from coronavirus in the United States, as well as many in other countries. So we need to make a push from our community to our policy leaders to make sure that these equipments are there.
So unfortunately, this is Sandy. I have to be the bearer of bad news. We have to end our telebriefing because our our teleconference call was supposed to end at 11 and we're over time. I can't thank our speakers enough for the extraordinary insights you provided to us. And I know we're going to have many questions, which I hope over the next day, if we send them to you, you'll be able to answer. This has been the start of just an incredibly valuable conversation for us, and you provided a great bridge for our understanding to enable us to improve and expand our coverage. Thank you for your generosity. Thank you for your time. Thank you for your dedication to all of our health. And Sunita, thanks for an excellent job moderating and for setting up such a terrific lineup of speakers. Blue Shield, again, our thanks. Above all of our media partners, thank you for being on the call.